Thanks for joining everyone this evening. Um, as you come into this session for attendance purposes, please type your name in the chat box along with your title, parent, caregiver, etc. This presentation is an overview of OPWDD and care coordination. OPWDD stands for Office for People with Developmental Disabilities. You'll probably be hearing a lot of acronyms this evening. We have some very knowledgeable presenters here tonight from ACA. Advanced Care Alliance is ACA. I just can't say enough about this team of professionals. They work with many of our families, helping them navigate through the whole tedious OPWDD process, from beginning to establish eligibility to benefits, to being assigned a care manager. So before I introduce our ACA presenters, I'd like to give Jenny Anderson, who is the Family Engagement Facilitator for Family and Community Engagement Center, again, the acronym FACE, the opportunity to share some information and resources with us. Okay,
Thanks,
Jenny.
Thanks, Wendy. Yeah, so I'm going to share my screen, which means I think it was Jillian that was sharing. It's going to stop your share. So you'll have to reshare when you're up, if that's okay. Hope I don't miss you.
Yeah, no problem.
So thanks for inviting me here tonight. The organization that I work for is it's through Long Island University, specifically the Center for Community Inclusion. And we are a grant funded project through the New York State Education Department, specifically their Office of Special Education. There's these, every region in New York State, there's 14 regions in New York State, houses one of these centers called the Family and Community Engagement Center. Our mission is singular, and it's to help improve outcomes for students with disabilities. So we support families and school districts with children from ages 0 through 21. We do regional workshops on everything from things like Special Ed 101 to IEP development, training of the parent member, things like that. But aside, and everything's free, everything's at no cost to the participant. But aside from that, what we also do is we have an intake line, and you'll have my email. I'll ask Ravi to share out the flyer. Anytime you have a concern, you're confused, you're not really sure, you understand something that happened at a CSE meeting, or you don't really understand something on an IEP, you can call us and we'll help walk you through it. I have 20+ years of experience in the special education field as both a professional and a parent. I have a 21-year-old daughter who's almost launching for self-D any minute. We can't wait. So this is our one-page flyer that we hope explains a little bit about who we are. And these are all clickable links. We work really closely with another grant. It's the same funder, State Ed Office of Special Ed, and it's called the Regional Partnership Center. They have behavior specialists and literacy specialists. So if I needed to refer you out, I could do that as well. But what I wanted to share in the chat is, if you're interested, I put a link in the chat to our listserv. So if you had this flyer, you would be able to click on this here called Tips and Topics Tuesday. Every week on a Tuesday, we send out all of our upcoming workshops. Most of them are virtual because we have found that's how parents can best attend. I know I can best attend that way. So we send out all of our upcoming workshops, and then, some tips about the special education process. So some of you might be nearing the end of the special education process because your kids are getting older, but I'm sure you have, peers, colleagues, friends who are maybe starting out, or you're part of your school district SEPTA. I hope that you'll share this information with them. So I put the link to sign up for our listserv in the chat. It'll look like this. And then I'll also put the link for the website in the chat as well, in case you have questions about exactly what we do. It's all listed here. And then I'll get the flyers. I'll email the flyers to Ravi, and I know he's shared plenty of our information. So if you want to reach me, please just anytime. I'll also put my email in the chat. Yeah, thank you so much for giving me a few minutes of your time. I appreciate it.
Okay, thanks for sharing, Jenny. Once again, if you're just coming into the presentation, if you could type your name and your title into the chat box, I'd appreciate that. Also, if you have any questions during the presentation, type those questions in the chat box as well, and they'll be answered before the end of the presentation. So now I'd like to introduce the ACA presenters. Like I said, I can't say enough good things about them. So Christine Bryan is the Director of Member Outreach. Jillian Nat is the Care Connection Specialist. And Dina Forgione is the Assistant Director of Admissions. So thanks for sharing your expertise tonight. I'm going to hand it over to you.
Great. Thank you so much, Wendy. We really appreciate it. And the same, we want to tell all the families that you are so lucky to have Wendy and be at that school, because she's amazing and connects families to us directly. She's been really, really a great asset. So we're just going to kind of go through a basic overview of what a CCO is, how to enroll into care management, how to get that eligibility, some of the services that a care manager can offer. So we figured we start there. If you have any questions, please feel free, put them in the chat. We'll address them. I'm lucky to have the Care Connection team here with me. Usually they don't attend, but they definitely wanted to come meet Wendy and all the families. So if you can you can move it, right, Jillian? I don't think I have access to that. Okay. So a lot of questions are, what is a CCO? I'm sure that you might have heard different things: care coordination, care management, CCO. It's basically a care coordination organization. So all the CCOs provide care management to people with intellectual and developmental disabilities. So on Long Island, there are 3 CCOs that you're able to connect with to get care management. ACA is one of them, Tri-County Care is another, and Care Design is the third one. So you have the choice of which CCO you want to choose. You can do that by, looking at the websites, reaching out, calling, where the outreach team is able to speak with you, tell you some of the perks that we would offer that maybe another CCO won't, but basically we all do the same thing. CCOs will provide you with a dedicated care manager. We like to set you up with a care manager that lives right in your community, in your region. They know the supports out there. That's what they're there for, to link you to services in your area. So care managers help people with disabilities connect and link you to services needed, support people of all ages. Sometimes that's a big question, like how old can someone be? So usually it's, could be anywhere from, a child all the way through to, elderly people. They assist with school things, work, home, health, community, and different life changes that are out there. So they're there really to be a support and help you navigate these type of things. Care managers help identify programs to help the member reach the goals. So that's when, once you're enrolled with the care manager, there'll be a life plan, and you'll determine with your circle of support group different goals that you want to reach. The care manager is going to be the one to link you, help you find those services, whether it be in the community or an OPWDD service. They're there to connect you and help you navigate that system. We know it's very confusing. We know there's lots of steps. Things are always changing. So that's where our agency, our teams are a great resource. We help you navigate different changes. Something that happened a few months ago might be different right now. So we're there to connect you and help keep the process going for you. Care managers support transitions. It could be any type of transition from high school to adult life, or even sometimes it's preschool to CSE or CPSE. Anything like that, the care manager is able to help navigate that transition, help the families get things coordinated. Healthcare promotion is another thing that care managers can help with, coordinating healthcare. It could be something as a situation where somebody's in the hospital and they can't be discharged, say, until they have A, B, and Z in place. A care manager is somebody that can help coordinate that discharge meeting, get those in place so that they can leave. Or it could be something as simple as wanting to, be healthier, or if they're a diabetic and they need different trainings or different medications, they're there to help you with healthcare promotion as well. Care manager also can assist with benefits. If it's applying for SNAP, maybe HEAP, making sure that Medicaid is always, renewed in time. The families, of course, are the ones in charge of all that kind of thing. So if you do get letters in the mail or have questions, definitely let us know. We have a lot of support departments in our agency that can assist and help guide the families on the best next steps or how to apply, or different tips on, how to apply easier sometimes. Steps to get started. Reach out. Our outreach team is able to help educate, help guide you in the next steps. We'll get you set up with our admissions team or Care Connection. Completing the front door process is something that each family do. As of February 1st, the process has changed a little bit. So now it's watching some front door videos. We do have a link that we can send you. And you can look at the videos. There are a lot of like 5 to 7 minute videos you can look at. So if you're interested in the eligibility process, if you're interested in self-direction, if you're interested in how benefits work and children's Medicaid, there's little videos on there. So you can, watch them at your own leisure. They're in different languages. They're trying to streamline and make the process a little bit easier for families. So you can get a head start and go through there. And I have a link that I could attach to the chat later if you want to use that and get started. Our teams will help apply for that eligibility. Jillian will get into that in a few minutes of what's needed to apply, but that would be the next step to determine if you're eligible for these services. The next step after that could possibly be the Medicaid eligibility process. We have a Medicaid benefit team that works alongside our admissions team as well to help guide and apply for services if eligible. And then the last step would be enrolling with that care manager. So all these steps need to be in place prior to get you that care manager in the end. So the next step, I'm going to pass off to Jillian, who is one of our Care Connection specialists. She works with most of the families in your district, and she'll get into how exactly, the next steps are and what would happen once you make that referral.
Hi, I'm Jillian. So OPWDD eligibility. Some of the qualifying diagnoses are intellectual disability, epilepsy, seizure disorder, autism, neurological impairment, cerebral palsy, familial dysautonomia, Prader-Willi syndrome, Down syndrome, other qualifying conditions. I do get a lot of questions, usually about genetic conditions, which do qualify with the right documentation. So I always like to mention that when I speak with families. Other qualifying factors, onset before the age of 22. So it is a requirement that you were diagnosed with a developmental or intellectual disability before the age of 22. If past the age of 22, they will ask for early onset records. Indefinite duration, so that the disability is expected to be permanent, and your impacts on the adaptive abilities in your life. Family support services. Once OPWDD eligibility is obtained, you can receive family support services while waiting to enroll in a CCO. Things that you can get within family support are family reimbursement, usually referred to as voucher reimbursement, things for goods, recreational activities, things like horseback riding, swim classes, karate classes, piano lessons, camps. I get that question a lot. Even respite if you pay out of pocket for a sitter, usually that qualifies under the reimbursement category. Adaptive technology, environmental modifications, If your child uses an iPad or some sort of software to communicate, those things can be reimbursed through adaptive technologies, or you can utilize an agency to get the equipment. If you need something in your shower, a bar, things like that, those qualify usually as well for an environmental modification. Advocacy services, these are for individuals that don't have Medicaid but have eligibility. They can assist with just helping you navigate that grant book, finding what services are appropriate. There's tons of different types of respite. There's after school respite, site-based respite. Respite in general just generally means caregiver relief. So it could be in your home, it could be at a facility, it could be during a school break. So it's a really highly utilized service. There's also parent training. I know the schools also offer it, but in the event that the school doesn't, it is a really good resource as well. There's also sibling training as well. We didn't list all of the things, services within family support, but that's also a good thing to use. Recreational activities as well, like I mentioned before. And Medicaid eligibility. Was I still going, Dina? I wasn't sure.
I think this is my turn,
Okay.
Jillian.
I'll head it off to Dina. Thank you.
Thank you. And hi, everybody. Dina Forgione, Assistant Director of Admissions. So glad to be here. Thank you so much for having us. So I'm going to talk a little bit about Medicaid eligibility. So Medicaid pays for all of the OPWDD services that are through the what's called the HCBS waiver, which I'll explain in a few slides. CCO enrollment begins after Medicaid is approved and OPWDD eligibility is obtained. So first, is the OPWDD eligibility. That's exactly what a Care Connection specialist such as Jillian would assist you with in gathering documents and submitting it to OPWDD. And then Medicaid would be the next step. We do have here a Medicaid eligibility team at ACA. So first you would work with Jillian, and then she would do kind of a smooth handoff to the Medicaid eligibility team. The Medicaid team here would assist the individual and family with applying for that Medicaid to pay for the services. Go to the next slide. Thank you so much. So there are a lot of myths associated with Medicaid. It's kind of a scary and intimidating topic for some of our families, and I totally understand why. So some of the myths that are out there is my child can't get Medicaid because I work or because I make too much money. There are ways in which families can get Medicaid coverage. There's a process called parental deeming that Jillian and our eligibility coordinators here in the Medicaid department would assist with. So we also do have a specialized admissions team that would assist with that parental deeming process. So there is a way to get your child Medicaid if you do work. So we would support you every step of the way with that. The other myth there is I don't want to give up my own health insurance. So the good news is that you don't need to cancel any private health insurance. Folks can keep their, if it's a student and a child, they can keep their parents' private insurance and then also apply for Medicaid and get that Medicaid coverage. So you kind of get best of both worlds there. My child isn't old enough to get services and supports. We do have some younger children that come through the pipeline, elementary school, middle school, high school. We really support everybody with requesting OPWDD eligibility. And there are a fair amount of children that are able to apply and do get approved for OPWDD services. Everything does need to be justified. It's not, everybody doesn't get approved, unfortunately, but we do have the resources here to be able to give people the best shot possible to get the services. And then the other myth that's out there is there's no one to help. So like I said, we do have Care Connection specialists. Jillian is our main person for William Floyd School District. We also do have bilingual Care Connection specialists should there be someone who does not speak English. So we have a variety of support here. We have the Medicaid eligibility department and then specialized admissions coordinators who assist with Medicaid for families of young children. So we have a big, robust team here, willing and happy to help. All right, so what services are available? I know one of the questions out there floating around is, what is the HCBS waiver? So I just kind of want to touch on that, and then I'll talk about the services that are available. So the HCBS waiver is the Home and Community-Based Services Waiver. That is the Medicaid program that provides services to adults and children with developmental disabilities that are eligible for OPWDD. And these services are provided in their home and in the community. So that's pretty much what a waiver service is. It allows you to receive a service, a formal Medicaid funded service in your home or in your community. So these are some examples of the services that are available through that OPWDD waiver. And I'll kind of run through the list here. Day habilitation is a very popular service for a lot of folks who are transitioning out of high school. There are several different types of day programs. There's Program Without Walls, very community-based day habs, and then there's others that are available. Once you're enrolled in a CCO and you're assigned a care manager, they would help you with finding the proper program that would best meet your needs. So you're never alone in finding any of these services. The next service that's funded through the HCBS waiver is housing. So there are commonly known as group homes, but there's different types of residences that are available through OPWDD. There is a little bit of a wait list at times, and certainly certain people are prioritized for this, but it's available to folks generally 18 and over is the age group that we see applying for residences. Employment support, another big one for folks who are transitioning out of high school. There may be job coaching, supported employment, and other job coaching assistance that's available through OPWDD. Again, care managers assist with exploring the best fit for the individual. Respite is a support that, there are actually a variety of respite services. Luckily, this service you don't actually need Medicaid for. It is grant funded as well. So if you have your OPWDD eligibility, as Jillian had reviewed before, you can actually get respite through that family support grant booklet. So it is paid through Medicaid, but you can also access it as long as you have OPWDD eligibility, you're good to go. Community habilitation is a Medicaid funded HCBS waiver service that basically allows a staff person to come into the home and work individually with the person and kind of work on goals that they identify themselves. They work in the home, but also go out into the community and work on social skills, work on things like budgeting, learning how to make purchases in the community, and really whatever the person would like to do to enhance their quality of life and their independence. So it's a really popular service and in my opinion, a great one. Self-direction is a very popular support. It does require quite a bit of work on the part of the family as well as the care manager. There's, several applications that have to be submitted for this service, but it is a way for someone to be able to access funding, and it's a really nice person-centered, community-based service. It's something that, like I said, it's a little, it does require lots of family involvement. So. But again, it's a great service. One of those videos that Chrissy had mentioned earlier that's available on OPWDD's website does educate people in the community about self-direction. So highly recommend that. Oh, thank you, Chrissy. You put that in the chat. That's great. So definitely take a look at that video. Assistive technology, similar to what was discussed, although there is assistive technology that's available, Medicaid funded as well. Things like iPads, devices for communication, grab bars, things like that could be available through assistive technology funded by Medicaid. And then last but not least, environmental modifications. Some examples of that would be getting a wheelchair ramp put on your home, getting a bathroom modification so that someone can independently, get in and out of the shower perhaps, and just allowing the environment to help someone increase their independence and safety within the home. So those are just kind of a quick snapshot of some of the services available through the HCBS waiver and funded by Medicaid. And then getting started with services. So care managers work with the person, their family, and their circle of support to develop a life plan. That life plan really identifies everyone's goals, their wants, their needs, and it guides the services a member will receive. So someone would like self-direction, someone would like, all the services we talked about. The care manager would assist the person with identifying that and then making sure it makes its way to the life plan and gets authorized. And I don't know if I missed anything, Chrissy or Jillian, but feel free to chime in and I'll toss it back to you.
No, I don't think so. I think the one important thing too to note for family support services, if you are deemed eligible for OPWDD, there is a Long Island grant booklet. The new one just came out. It's like 40 something pages. So once you get that eligibility, provisional or permanent eligibility, you're able to access all of those supports in there. And some of those things Jillian had mentioned, like whether it be respites or that voucher reimbursement. So if you have that eligibility already, you already have, the first step and you have access to all of that already without care management, without Medicaid in place. So, that's a great service already that you could start using. It kind of bridges the gap to the next step. Why choosing ACA? So we get this question a lot because, like I said, Tri-County Care, Care Design, ACA, the 3 CCOs that serve the Long Island area. So, and we all provide care management. We all help apply for eligibility and Medicaid. But we do like to highlight some of the perks that ACA does have. First and foremost, our CEO is a parent of a person with an intellectual disability. He uses self-direction. He's very in on what helps, what does not help. It's very important to him, and it's great that we see or we're led by someone that is in it. And so he understands it, he gets it, and that kind of helps guide us in the right direction as well. On our website is so full of resources that's always being updated. So we have this community resource tool anybody can have access to. You don't have to be a member. You can find supports and services in your area. You click on that link, say, you just drop down Suffolk County respites, search, it'll pull up different, services that are out there. You could do that for healthcare providers. Feel free to go in there under our resource tab, as well as the Knowledge Center. There's so many great informational pieces that some of them I put in the link already, but there's different videos, there's different flyers in there that kind of list like the steps, like what do you need to enroll? What do you need for eligibility? What does a care manager truly do? How can a care manager apply for this? A transition checklist. So if your child is going to be aging out of school soon or graduating, here's a few things that maybe you should start working on or, working towards. So there's a lot of great resources in there. We also have member family forums every month that you can join in on. It has anything from, say, legal guardianship one time to actually member liaisons running some of these programs. So they're parents of people that are members of ACA. We also have a new member orientation. So once enrolled, you'll be invited to an orientation session via WebEx. It'll explain exactly what's going to happen now in these first 3 months of care management. Because people think, day one, I'm enrolled, now what? So of course, there's going to be more steps, how to get that life plan in place. Some assessments that have to be done, getting to know the person, meeting them. So there's, guidelines that are and requirements that need to be done in those first 3 months. So we offer that to families that they can jump in on, whether you do it the first month or the second month, It's a great opportunity to learn more and speak to people that are in it, as well as some of our support teams. So that's like a few of the things that we can offer, but I definitely encourage you to go through our website because there's a lot of great resources in there. We also do have a customer service center. It's 24/7. So if you're looking, say, to resolve issues, you're trying to find someone, you forgot their name, we understand there's so many people that you speak to during this entire process. The customer service center is there to, resolve your concerns, answer your questions, link you to the right connection, provide information. They'll be able to track down whoever you're looking for. You can do that via this email or our 833 number anytime, and they'll ensure that we'll reach right back out to you. And we also have a direct referral line or QR code if you're ready to refer over, you just want to call, get things started, or fill out an online thing. We do serve 10 counties across New York, obviously all of Long Island, but then we do a little bit of all the New York City boroughs and then some of Lower Hudson Valley. But if you have any questions, please feel free to reach out to us directly, and we can get anything answered. And then we just wanted to open up to anybody if they have questions about anything or you want more information about anything. I did put some links in the chat for the front door videos. I put the specific one for self-direction, our common acronym list, which I think is like 7 pages long, because we know, this whole field is acronyms. So you can click on there, as well as, additional care management information.
We'll give it a minute or so. If you have any questions, just type them in the chat box. There are also, this was open to out of district as well. So there are parents here that are from other school districts.
Sure.
I also have permission from our friends at ACA to share the PowerPoint, so I'm going to put that in the chat as well. Feel free to download it, but I'll also email it out after today's presentation.
Okay, so there is a question in the chat box. In order to apply, do I just call the referral line number or go online?
Yeah, you can, if you have questions or you want to do it directly, you can reach out to me directly. We'll connect you, or you could do, the enrollment line, you just plug in your information, we'll get started, or the same with the phone number, whatever you prefer, or it's easier for you.
Right. Many parents in the William Floyd School District start with me, and then, I discuss the different agencies, the CCOs, and then they go through, they make the contact, that initial contact with OPWDD, and then we make the referral together to ACA or one of the other agencies.
Right. Yeah, it's important to kind of go through your evaluations. Wendy's great at that, setting up. She knows exactly what's needed, but if you're not in the district, they'll look for that, medical evaluation that's done within the past year. They'll look for your IEP or any school reports that are applicable. They'll look for that autism evaluation, if that's the diagnosis, the psychological evaluation, which is like the IQ and adaptive, social history. So we can help connect you to that as well, but a lot of school districts do that internally. So that's really what we would, coordinate and send over to OPWDD, which they'll review and then kind of, let you know if anything additional is needed.
Okay. Can you see the chat the information in the chat? Okay.
Yeah.
There's another question there. We received OPWDD provisional eligibility, but have been trying since July 2023 to get the CANS interview done. Is it CANS? Is that correct?
Yeah, CANS or CAS, right? They have both.
Yeah.
Oh, yeah. Any suggestions on how to get this process completed?
Sure, I could jump in with that. So the CANS assessment is typically requested by the representative at the CCO you're working with. So usually your care connection specialist or intake person would make that referral. Other times OPWDD themselves will request that. So what I would recommend is if you're working with the CCO, let your person at the CCO, your care manager, whomever it is, let them know that you're in need of the CANS interview, and they will make that referral for you. There's an online referral process. I'm not sure if families themselves can make that, but anyone at the CCO could assist you.
Okay. Another question. To apply, do we need to come to your office?
Nope, you do not. You can give us a call if you have some questions. You can email us. We'll call you back, set up a time, whatever's easier for you. But you don't have to come to the office.
Okay, next question. So in talking about FSS, specifically environmental modifications, does that cover things like a cubby bed for a child for safety purposes?
Is it just through family support or waiver? I know if it's a waiver service, like say you're enrolled already, it would have to be part of the life plan. For family support, I'm not really sure. I know there has to be a lot of justification for environmental modifications. So that'll include like doctor's reports, some type of medical report showing that the need for it. So that I'm not sure. I would check that family support guide if you already have that eligibility, because they'll have it listed within the booklet. If you don't have that, we can send that over to you. I don't know if anybody else knew. Jillian, you have any other info on a environmental type?
I'm looking up. Yeah, I'm looking up the approved, the allowable, non-allowable items. I believe like sensory-related items are covered under voucher reimbursement through family support. Once
Yeah, you
enrolled
can
with
get money
waiver,
towards it, right?
usually they're covered under like environmental mod. Yeah, if you don't have self-direction, you can usually access family support, but you kind of go to the bottom of the needs-based list because you obviously at that point have waiver in general, but you could still access reimbursement.
Okay. Next question.
So I don't see like a bed. Sorry, I don't see like a bed specifically on here, but usually items that aren't specifically on the list. And Wendy, I could share the approved and non-approved PDF with you. But usually OPWDD has the final say on anything like not on their list. So it's worth a shot at least inquiring.
Okay.
Yeah, and our tip to you is if you have the eligibility already and you haven't started using things in that booklet, definitely start, jot it down. What time did you call to see, because a lot of families be like, I tried it, nobody answered. OPWDD is going to be requesting more information than that. They want to know who you spoke to, who said they didn't have that service, when did you call, try again. They want to see that you're attempting to use family support services, which is a grant or state paid, prior to needing Medicaid for those services. So a lot of the services waiver you can get in that family support grant. So they just kind of want to see what you've tried and, try to exhaust that a little bit too.
Okay. Another question. I signed up for OPWDD a few months ago, and I've been waiting on a number. They said, can you guys help me along?
Is that like a TABS number maybe?
Waiting on a number, probably the TABS ID. That shouldn't take more than a couple of weeks to get.
Right?
Right. Sometimes
Um,
just a few days. So that's something the CCO could definitely bridge the gap with and reach out to them directly for.
Yeah, because I feel like sometimes if you call and leave a voicemail for them, right, the front door will call you back. Not usually within a certain time frame, but then they'll have all that information for you and assessments
okay.
scheduled.
My school district is doing all the evaluations. Should I wait until it is completed to contact you?
You don't have to wait. You can call. We can get started. We could see, you know, what you're interested in, what evaluations they have, or have had in the past, diagnosis. We can get consent signed, and get that kind of stuff done.
Okay. I think this is from the person before. We have made 5 requests already for cans. No one responds.
I know for cans, a family can't make the initial request, but they can follow up if there's an immediate response needed. Like somebody has to make the referral for the cans, whether that's OPWDD or one of the CCOs. But a family can't just call and request a cans on their own. They can just expedite the process once the referral's made.
The person that was saying about the FSS said not enrolled yet, just trying to understand the process.
Yeah, so if you have eligibility for that person, definitely access that grant booklet. If you don't, then that application, once that OPWDD eligibility application, if you're deemed eligible, then you'll have access to it. So that would be definitely the first step.
Okay. How do we access the ACA New York Care Manager info.pdf in the chat?
Is that the PowerPoint that they uploaded?
Oh, that's what they're looking for, yeah.
Yeah.
I uploaded some documents. Are they able to be opened by you guys?
Yeah, you can download it, I think. Yeah, I downloaded it, so I was able to do that.
Okay.
Okay. I missed one. Can a stroller for a 7-year-old who does elope? I guess that's is that for the,
The family support, maybe?
yeah.
I don't believe strollers are approved.
Can that be covered?
Did you add that link in here, Jillian, or no?
I added the PDF. Yeah, strollers are under the non-reimbursable items, unfortunately. I did. It's on the third attachment that says FSS. Using it as FSS reimbursable, allowable, non-allowable items. That's directly from OPWDD.
Next question. So is self-direction really a separate application process, even if it's listed as an OPWDD service? Can you participate in self-direction as well as the other home community-based services? When does one apply for self-direction?
So I don't know, Jillian, do you want to take that one? I know you have more hands-on experience. If you don't mind.
So self-direction, the way that it is explained to us from OPWDD is that it's not necessarily a waiver service. It is a funding stream. It is a budget that you obtain from the state to self-hire your own staff, pay for your own job coach. These are really the reasons we don't see younger school-age children getting approved for this. So I would say, generally speaking, transitionally aged children tend to get approved for this service. At this point, within our department, it is not something we generally apply for, just to kind of get those waiver services turned on. But we always explain that once the waiver services are turned on, that self-direction service can always be added on once enrolled and assigned to a care manager. But it is a service, but there are lines within a self-direction budget that actually are the waiver service. Self-direction itself is not, like integrated goods and services, which it's in like that FAQ video on their website, but that's typically why it's not a quote unquote waiver service itself. I hope that makes sense. It is confusing.
And it is a whole new application, or at least feels like it.
Yeah.
Okay, another question. I submitted all of the necessary paperwork for eligibility. Do you know how long it usually takes to get a response?
I can answer that. So I always tell families that the first review of the documents is typically within 30 days. That doesn't mean that you're going to basically get an eligibility letter. There is a 3-step kind of review process. So they generally just acknowledge that they've received the documents initially within a day or two. And then within 30 days, they will either award eligibility, they can move the case to a 2nd-step review, or they can request additional documents, which is extremely time sensitive. So if you do get a letter in the mail and you haven't heard from whoever you are working with as a CCO or one of the service access agencies, definitely reach out to them because they're going to be the responsible party for submitting the additional information.
Okay, somebody's asking to please resend the acronyms PDF. It's not accessible.
Okay, I will do that now. Yeah.
Can I ask a question?
Sure.
She actually just responded to my question. I was the one who asked about how long the process takes. I did submit paperwork, and in that 30 days, I did get a request for additional information, which I sent in. So I guess I should have put that. I didn't put that. So I did submit the additional information in February. So I wanted to know how long from there it usually takes, because the person I'm dealing with, she doesn't respond that much to me. So I don't know if I should be waiting or if I should be emailing still. What should I be doing?
I typically tell families, usually after an additional document is submitted, it can take usually about 2 months or so, within 2
Okay.
months for them to kind of review. I don't know that that's an actual like approved timeline, but that's what they've kind of told us to give them enough time to review. But you can also like absolutely contact whoever issued that letter, and just ask like to make sure that they receive the documents, that your child's in the process for Q review. Sometimes a decision is made and maybe the letter wasn't completed at the time. So you may
Okay.
if it gets to the point where you're like still not hearing back and you're getting close to that 60 days, you can definitely reach out to OPWDD themselves or the person who like wrote the letter.
Okay, great. Thank you very much.
Yeah.
Is the number to enroll 844-436-8196? There's a thumbs up.
Yeah.
I guess somebody answered that.
Yeah, that's the referral, outreach referral line. Yeah, or they can call me directly as well. But that's like our general team outreach referral line.
Okay, still cannot access. Can it be sent as a PDF? That was
I'm
for
trying to do that. I don't know what the problem is here. This chat box is not letting me add
I think I just
easily.
uploaded it.
That was the
I think it's the same
acronym.
one you have,
That's the
Christy.
acronym, right?
Yeah, the acronym.
Mm-hmm.
Are you okay? Yep, that's it.
Just let us know if you were able to access it. Yes, she was.
Great.
Okay. Wait, I don't think there's any more.
I did just want to add, because I think it's important as well. If there is a lack of information for your loved one before the age of 22, there are other ways. It's not impossible to get eligibility. You can write a letter of support, which we explain, upon speaking with the admissions department. But a lot of families are very scared to even apply because they maybe don't have early onset documents. Obviously, every case will not be approved, but with the right information, documented, it is entirely possible. And depending on the actual qualifying diagnosis, additional documents other than the required documents may be required from OPWDD. I don't know if this was mentioned before. I was locked out before, but for autism, they do require that autism diagnostic evaluation. For seizure disorder or epilepsy, they do require some sort of paperwork from a neurologist. For genetic testing, for a genetic condition, they do want copies of genetic reports from a geneticist or some specialist that a child is seeing to indicate, when the diagnosis was made, how it impacts the child on an everyday level. And those are really things that they're looking at, is like the adaptive deficits. It's a really, really big factor.
And just to add to that, I also wanted to say, if your loved one, for whatever reason, gets a denial or there's multiple requests for information, your Care Connection specialist is there to support you. And I know Wendy is so wonderful as well with advocating. So, just a denial does not always mean you're denied forever. We can always request a conference call and support you through that process. So, we see many people, not get through on the first round, and then they're able to get an approval. Just want to throw that out.
Can you do self-direction and CDPAP together?
Yes, you can, as long as the hours don't overlap. And services can only be taking place when somebody is awake. I know we get a lot of questions like, overnight care, things like that. That's usually handled on the CDPAP home health aid avenue, because that's like a Medicaid funded, separate from OPWDD channel. But yes, I've definitely seen both. And actually, OPWDD really likes when somebody has CDPAP as well. It is additional support, and the services, as long as the times don't overlap, they work entirely perfect together.
Okay, a response was, this is good news. Many districts only do what is needed to get services needed when in school and do not always do testing for autism, especially if they are higher functioning. Right.
Yeah, we do have a lot of districts that don't do specific testing. We do have some resources that we could share with families. You're also more than welcome to go through your own insurance, see maybe what is covered under an out-of-network provider. But sometimes, we try to obviously keep costs in mind. We do have some numbers from certain private psychologists that we can definitely share for certain testing. Some are very fair, some are obviously higher. But we like to try to give resources when we can, especially if the schools don't have it in budgets or they don't have the right staffing to complete tests.
Okay. Give another minute for any other questions. I put my name and my number and my email address in the chat as well for the William Floyd School District families. Where can we reach out for $3,000 grant? Is it still offering for OPWDD eligible?
So the $3,000 is part of the voucher reimbursement limit. It is limited to like $3,000 per individual per year. I did attach the family support grant book that was just updated, I think February. It's in the attachment. So you open that PDF, it is a lot of pages, but you're going to want to go to the tab that says voucher reimbursement. And there's like maybe 4 pages of providers that you would just, filter out by your county. And basically, I think for voucher reimbursement, it's only done by county. So some are for by county services, some are only Suffolk or Nassau. And if you do have self-direction, you're not entitled to the $3,000 for reimbursement because it's in the self-direction budget.
I'm sorry, can you repeat that? So the 3,000 is part of the voucher, but not part of self-direction? Is that what you said?
Yeah, the $3,000 is a reimbursement through family support. If you do have self-direction, once enrolled with the CCO, there is like a separate line for reimbursement for goods and services. So if you look in the actual grant book I attached, it will say like if you have self-direction, you can't utilize. So it is just like a disclaimer, you can't have both.
Okay. Again, I want to thank the ACA team for their expertise, for taking the time to do this tonight. You guys are really wonderful to work with. And, I'm sure that, I know William Floyd School District families are helped incredibly by you. And you're so supportive. I'm going to keep on referring. So thank you again for sharing.
We love you, Wendy.
Thank you
Thank
so
you.
much for having us.
So much.
Yeah, and if anybody has questions, definitely, feel free to reach out. We'll answer any question you have. And go to our website. Good stuff.
Okay, thanks so much.
Thank you.
Good night. Good night.
Night. Take care.
Bye.